Welcome to Hey Doc, Dr. Cutler, my co-host, Dr. Valdez.
In the house.
So today we want to go a little bit more into some of these health talks and just a brief introduction of who we are. Specifically, Dr. Valdez today. Last time, so we talked a little bit about me. It was way too much for me. Today, I want to get a lot more about Dr. Valdez, his philosophy on things, and kind of see what made him the way he is. Because I don't know, he's a little bit of a big deal. So. We'll start with just a very simple, very broad question, and we'll see where he takes this. But why chiropractic? I know a lot more about you than most people, and so I know what things you've done because you didn't get into chiropractic until later on in your life.
Right.
You'd already done several things. So
Yeah.
explain that to me.
Yeah, so I was living and working overseas a lot and was traveling a ton. I was not living a healthy lifestyle at all. And my doctor actually put me on broad spectrum antibiotics because I was traveling so much, I was getting sick with everything. And so for almost a year, I was just taking broad spectrum antibiotics, not for anything specific, just to keep me from getting sick. And it was depleting my vitamin K stores because antibiotics kill off your gut flora, and that bacteria is what produces our vitamin K. And so I was really vitamin deficient. I was tired all the time. I was super stressed out. And I remember a distinct moment where I thought, I'm not going to live to see 40 if I keep up this life. And so my my niece was born with a genetic condition called Prader-Willi syndrome, and she was a big impetus for me getting into chiropractic. My sister really fought for a diagnosis with her, and we entered this, what we call the coolest club you never want to be a part of. It's called Prader-Willi syndrome community, and it's the most incredible people, and they live with this syndrome, which includes a lot of different parts to it, but one of them was a musculoskeletal alteration where the babies are very floppy, they're very low tone. And so my goal was if I could help my niece Kimber have a straight back, then that would be great. And if I help a few people along the way, that's good too. But as I got into chiropractic, I started to realize how much of what we do is based in neurology. And Prader-Willi has a lot of neurology involved as well. And so that's where I really got into adjusting babies and pregnant moms and taking care of the nervous system rather than just laying people down and pounding out the high spots like I think a lot of people think chiropractors do.
Yeah, I mean, a lot of the time I feel like we get a lot of just putting motion. I mean, even in several chiropractic clinics that I've worked in personally, I know that you've worked in as well, we're taught, oh, it's just increase in range of motion. You're going to see improvements in range of motion as opposed to, okay, what are the neurological benefits of it? And I know you and I have had many philosophy conversations about like vagal nerve tone, different things and different effects it can have.
Right.
And I mean, you specifically in the pediatric and pregnancy space, I kind of want to know like, so we know why you went into pediatrics because of Kimber, because of Prader-Willi syndrome, because of that, and that kind of gave you that love. But like, how do you, when you have someone ask you, and I mean, there's a lot of people out there who say, well, why would you ever adjust a baby? Tell me about that. Like, what is adjusting a baby?
Right. First of all, it's nothing like adjusting a human, as you know. A little bit different than adjust you. Yeah, yeah.
Babies are still good.
Well, yes, but kind of not. It looks nothing like when I adjust somebody your size, obviously, because their skeletal systems haven't fully formed. They're mostly cartilage, and they're just these gooey little chunk monsters that sleep and poop, and that's about all they have to do. So there's a lot of considerations like gravity that they're just getting acquainted with, and so those parts of their systems are still forming, and that's why it's so important to get them adjusted early on. It's like when you get a cell phone from your carrier. The first thing you do, you pull it out, plug it in, and it says I have to update. It's like I just barely got you. What do you possibly need to know about updating? And that's what it's like when you have human. Baby pops out and it needs a neurological update. There's actually a lot of research out there. It's kind of cool that the reason humans are so limited in our gestational periods. You think about how long an elephant carries a baby, and it's like 2 years, I think.
Oh yeah.
Because they can form neurologically, they're okay to stay in there that long. Humans, we can't. Like our brain size and capacity gets to a certain point in 9 months. We kind of have to birth and continue that growth on the outside. And so where a lot of babies are wiring a lot of those infant reflexes and those instincts in utero, human babies have to get on the outside and start having input and stuff for that update to happen. So we're forming millions of neurological connections every minute for the first few months of life. It's literally like a software update. on that system. And that's why I'm so passionate about getting to them early and as soon as we can, getting them adjusted and moving like they're supposed to. So
It makes perfect sense. Especially when you compare it to kind of sophomore.
right.
And I mean, I've adjusted babies. I've watched them adjust babies a lot, and very different techniques, stuff like that. If you if you go to a chiropractor and he wants to adjust your baby and he tries to do the same, and it looks like he's trying to adjust a big human, walk away, get away, go find someone who actually knows what they're doing. And because I'll be honest, not all adjustments are created equal, and especially when it comes to babies and kids, stuff like that, you need to be careful with what you're doing. And that's why having someone who has the experience, who has the training, who has that guy, who's had that guidance, will be super important for your baby and super influential on that baby's nervous system. And I mean, yesterday or 2 days ago, whatever it was, I I got onto this big kick. I was going through all PubMed, all these different research journals, and going through like all the research on chiropractic. And there was just a ridiculous amount, especially in pediatric chiropractic in kids, and its effect on constipation, its effect on colic, all these different things that like are typical problems with the baby. And what do we do in medicine that like, I mean, typically when you have a baby that's colic and stuff like that, what's the doctor going to prescribe them? And like, what's your response to that? Like, someone comes in and says, "My baby's been crying, constipated for this long. What do
Yeah. Colic is really tricky because it's what we call a multifactorial pathology. There's a lot of things going on there. It's not just one thing. And so it's kind of a catch-all phrase. Uh, a crabby baby, everybody just diagnoses it as colic,
we do?" Yeah.
And it could be something as simple as just the food that they're eating is not agreeing with them. Their formula and this super inflammatory diet that they're on, and you correct that, and the colic goes away. Or it could be something a little bit harder to detect, like a birth trauma, and that puts a lot of stress on the part of the neck. That puts that baby in that fight or flight mode, and any little stimulus just goes straight to that panic center of the brain, and you have this crying, newborn. That's really frustrating for a lot of parents. So when kids come in with colic, that's the first thing I want to educate them on is we take a really good history of what type of pregnancy they went through, how the delivery was, if there was intervention or stresses that would have increased that likelihood of a birth injury. And then we adjust, and we're just constantly trying to get that baby back to that rest, digest mode. And that has a ripple effect through all of the digestive system, as you know. And you asked me about that paper on vagal nerve stimulation. I still sent that to you, but I have it.
We'll go over that. I mean,
Yes.
that's something that's super interesting.
But when we give kids their brake pads back, like Dr. Tony Evil says in Perfect or the Pediatric Experience, give the kids the brake pads back. A lot of that stuff works on its own. Constipation is another one like that. That is a sign that that system is in lockdown. It's in stress mode, fight or flight mode. If you think when you're getting chased by a bear, last thing you want to do is stomp and fill the diaper,
Yeah.
Unless you're our president. But but with kids, it's really easy to see. Okay, I adjusted this kiddo. They pooped. Check that one off the list. That's a pretty clear correlation between chiropractic care and something like constipation. Which, as a profession, we've always made the argument that we have non-musculoskeletal benefits like digestion. And so, if we can show enough correlation with that, and it's like in the 90 percentile, when kids are well adjusted, they're having regular bowel movements. That's essential for a growing.
Probably the same with adults too.
It is. We just don't correlate that because there's so many other factors with that, and
a lot of it dietary wise. I mean, with adults are eating a lot more stuff. There's a lot more things that can go into that. And like we're talking about antibiotics, we got to look at that too, because that's going to play hugely into our body's ability to actually extract nutrients.
Yep.
From what we eat.
Exactly. Yeah. So I'm super passionate about that. Keeping babies adjusted, you keep them regular. It's really common, especially in the communities that I work with, these special need kiddos, for that system to get stressed out and shut down or sluggish. And parents reach for Miralax, or some kind of laxative there. Most, if not all, and I want to just hedge my bet there, I'm pretty sure all of them have not been studied for safety or efficacy in pediatric patients. But we're dumping this Miralax down kids, and we now have warnings from the FDA that is not a good solution. But it's all parents have, and so they're doing the best they can. Because I don't know what I would do if my kid was stocked up like that and I didn't know about this. But it's huge. So never thought I'd be as concerned with poop schedules as I am as a doctor of
Yeah.
chiropractic, but that's like one of the first questions that's always out of my mouth as I'm assessing these little nervous systems is, okay, are they pooping, are they eating, are they sleeping well? Because those are all signs that we have a well-adjusted kiddo.
Awesome. Okay. Next question. What's something about your profession, about the chiropractic profession that bothers you?
Ooh, we've had a lot of talks about this one too. I'm going to ask you the same one here in a second,
All
so be
right.
thinking. I, as a profession, I really get annoyed with the kind of the hero worship and the cult personalities that pop up from time to time. We don't see that in the medical field. It's really about the research and about replicability and reproducibility in chiropractic. And I think it's just because they feel so marginalized by the mainstream so often. I think we try to find somebody to put on a pedestal and to be our water bearer. You know,
Expose everything for this
yeah,
guy.
let's give
He's
him the
so
flag.
local.
We're all going to get behind him. And those people, they do really well. They burn really hot and bright and fast, and then they fall out of favor. And I've seen some of the legends from the chiropractic world that just become so drunk on their own adulation, they take advantage of the institutions that they once started to protect. And it sets our profession back decades every single time we do it. And one of my good friends, she's a huge advocate for associates being really careful about who they train with and identify with and promote,
Yeah.
because it really should be about the chiropractic itself and not about who is doing it or how they're doing it. And so I always try to avoid putting one technique even above another, because everybody has a technique that works for them. Every patient has one that works for them.
And that individuality when it comes to, I mean, there's
Yeah.
some techniques. I mean, it's the same thing as like supine. If you do a supine cervical on some patient, like it may work really well.
Yeah.
And then a seated cervical, like for me, I mean, you've told me multiple times that seated cervicals are a little bit better for me. Just easier to get my facets to move, less painful.
Yeah.
And so finding a technique that's specific to your body, allows your body actually move the way it's supposed to, and allows to get that nervous stimulation can get.
Right. And I think we kind of meddle our philosophies as a profession when we say this is the best technique, and it's like saying, oh, this is in medicine, you go to the doctor, you get a prescription drug, it works for everybody, as intended, bioindividuality aside, your body's going to metabolize that medicine different, but you're pretty much getting the same care across the medical board because they have so many rules about what they can and can't prescribe. In chiropractic, it's very, very different. It's all based on the provider, and it can vary from day to day. And so, as a chiropractor, when I provide an adjustment, it's going to be different from what you do. And Tuesday, Kaleb, might be different than Thursday, Kaleb, in how to provide that. But we need to be really careful that we don't try to make that a one size fits all or one doctor fits all promotion for that, because every chiropractor out there is doing good for somebody on some level. And you're going to have heroes and you're going to have detractors, and we've got to be okay with that. It would be the same thing in medicine if there was enough individual practicing of medicine going on rather than just prescribing.
Yeah. Well, as kind of an add-on to that question, do you think it's a good thing that there's so many different? Because I mean, there's so many different philosophies between chiropractors. Like
Right.
even here in Utah, like you go to 8 different chiropractors in the same little town,
Right.
and pretty much everyone's gonna have a different philosophy on what their doing does.
Yes.
Like what the benefits are. And do you think that's a good thing, or do you think it should be more uniform in our belief and our research and stuff?
Well, and I think the reason we have all these different varieties and there's hundreds of definitions of the subluxation complex, which is what we claim to treat. But I think most chiropractors um, are pretty unified on what we're about, what we're trying to do.
Yeah.
We run into problems in the medical research in the standardizing field because definitions matter and because what we do matters. And it's a philosophy that doesn't fit well with Western medicine, and we have to be okay with that as a profession. We keep trying to fit a square peg in a round hole.
About pill, giving someone a pill is very different than giving someone an adjustment.
It is.
The adjustment, I mean, it depends on so many factors. The doctor himself, like I can give 100 adjustments in a day, and every single adjustment is going to be slightly different.
Yep.
Because it's the person that I'm adjusting, because there's going to be some slight thing, and that's where it comes down to feel. Like some people, I may have a little bit more lateral flexion if I'm doing a cervical, or they may be more flexible. I may have to go into a little bit more rotation on certain things,
Mm-hmm.
and you can't do the exact same thing for every single person.
Right. And I think we need to stop trying to do that as a profession and just be okay with realistic progress on a very individualized, day by day, provider to patient level. Because once we start trying to do those studies that everybody gets the same adjustment all the time, you were talking just last night, at the kitchen, you're like, why are we trying to convince people that, why can't the results just speak for themselves? And I agree with that. I don't know what the answer is. There's no way to give an adjustment and not have the patient know if they got one or not.
Yeah.
So let's find another way to establish that what we do is working.
We've talked several times about research and studies and stuff like that. And I mean, if anybody, if you looked at our social media and stuff, you see the post that goes over like our education. And I mean, I know both of us, for fun, we go and read research papers. The problem is that people go and they read the introduction, they read the abstract of a research paper, and they think, oh, well, this isn't conclusive. They don't understand how you set up a research paper. Have you ever tried to set up a research project, like a randomized control trial, something like that? It is so intensely hard to do that with something with a therapy like this, because it's going to be different for everybody. We can't do a randomized control trial or you can't double blind it, because the doctor's going to know if the doctor's adjusting and the patient's going to know if they got adjusted. So you can't compare that to a sham, because how do you create a sham for that?
I had a crazy idea. You want to hear it? I don't know how legal this is under the Nuremberg Code, but
so that's a great premise for this.
It's a good disclaimer here. If everybody that was awake and alert right now signed a waiver that if I'm ever in a coma, like as part of my medical power of attorney, I want you to let them do an adjustment on me when I'm comatose. Take my vitals. I will be out of in a coma. So I don't care what kind of adjustment, if I get one or not. Just adjust a bunch of coma patients that have this pre-standing medical power of attorney to give them an adjustment while they're asleep. And we measure vitals like blood sugar, like oxygenation levels, like heart rate variability, those types of things, and see what the difference is between coma patients that.
And that's an interesting thing, because I did read a study the other day, and we could put some of these studies in the link below. But like, I read a study about vagus nerve stimulation and heart rate variability, and how heart rate variability will actually increase, which is a good thing. It means your body's more adaptable. It increases after an adjustment, which can mean that your body is actually going from that fight or flight, that sympathetic, to that parasympathetic dominant.
Yeah.
And that could be huge for, adaptation, for rest digest, for all these different things, getting the body out of that fight or flight mode.
Well, the Western medical world has started to realize the power of vagal nerve stimulation and the strength of that cranial nerve 10 or vagus nerve. And so they're building more and more of these vagal nerve stimulators. They have apps, they have little earphones you put in, and all these different things that are designed to increase your vagal tone. Chiropractors are the OG vagal nerve stimulators. We've been doing this for 100+ years, and we're just now seeing why what we do is working. But as we see more heart rate variability, more parasympathetic dominance in that tone, in that nerve pathway, we see that the adjustment is the strongest thing we can do to increase that vagus nerve. And now, they have these devices they're implanting into people's brains or spinal cords to try to increase that tone. Well, guess what? You don't have to do a $200,000 procedure and do that on a bunch of people. We can do that right now if you sit in this chair and give me 12 seconds of your life and measure the tone that changes with that. So I think as Western medicine catches on to the idea of what we're doing, they're trying to find a way to surgicalize or medicate
to control it,
to do what we're doing, but they're doing it with the old way.
And you can charge way more if you can medicalize something like that.
Absolutely.
It's the same thing with you look at something like marijuana. This is a pretty touchy subject for a lot of people, but that's something to where, especially in Utah, the medical institute, they try not to let that be passed as making it legal, because they haven't been able to control it yet. They haven't made like the total medical alternative for it, and I feel like that can be. It's one of those things. They're going to make a lot of money off of it, but because they're not making that much money off of the lobby right now, if people are just able to grow their own medicine, who's getting money from it?
And medical marijuana is really kind of an oxymoron, because there's nothing medical about it. We're trying to pharmaceuticalize what nature can give us. And so
I feel like it's what we do with most things, though. Like, you look at like allergy medication, a lot of times it's based, the chemical compound formulation is very similar to something like lavender. And these different things that occur in nature that we're trying to synthetically copy.
Because you can't patent lavender.
Absolutely.
So if you're going to make money at it, colloidal silver is another one that is so effective against microbes that the Bureau of Chemistry, when they first started out, they're now called the FDA. Bureau of Chemistry, when they started, they have all these letters that just said, hey, if we don't scare people away from colloidal silver and outlaw it and demonize this, we're never going to be able to make an antibiotic that people are going to pay for.
If you really want to go find some cool stuff, go look up colloidal silver and use it. It's phenomenal.
And I guarantee you, if you Google it, you're going to find this Smurf-looking guy that's blue with red hair, and it's going to terrify you that that's what you're going to turn into if you take it, and that's on purpose. So just know there's a big difference between argyria, which is what those individuals are suffering from, and just good old-fashioned colloidal silver. It's one of the best medicines out there. The Medici back in the during the Dark Ages, they were in contact with silver enough to get it into their bloodstream. And that's where they would give their babies silver spoons. And that's where that phrase came from. I wasn't born with a silver spoon in my mouth. It's because babies would suck on the silver spoon, they'd get silver particles in their bloodstream, and they were impervious to the bubonic plague. They wouldn't get sick with the plagues that were going around because they had all the silver that was killing it off. So they'd wear silver, jewelry and things like that to get it into their bloodstream and protect them from the diseases. So
that's super cool.
Yeah. I was in China a few years ago with a good friend of mine, and the people there, they would take pots of water and they'd put these beautiful silver fish that they would carve out of form out of silver. They'd boil that in their water before they prepped anything with it to kill off any bacteria or pathogens that were in their water there. And really healthy, vibrant people. So I think there's something to that. So that's why I'm a believer in silver.
And I'm going to go back. I'm going to backtrack just a little bit. We were talking a little bit about.
Wait a minute. Before we go there, you have to tell me what the biggest problem with our profession is.
Well, this point is still fresh on my mind. I want to talk a little bit more on. We were talking so much about the neurological stimulation that comes from getting adjusted, and I just want to put like a little philosophy point out there because I hear a lot, especially in the sports world, like tight muscles is what causes people to have, like when you say like a ribs out or something like that, or like when we say, hey, you're subluxated here, and someone's like, well, isn't that just because a tight muscle pulled something and it's not moving the way it's supposed to? Like, absolutely, but you got to realize there's a correlation. There's the nervous system is the very first thing, because if your body is sending that, if it's in that sympathetic tone, it means your muscles are going to be tighter. Because if you think about it, if I'm about to run away from a bear, my muscles are so tight on the spring, I'm ready to. But if I'm in parasympathetic dominance, where I'm resting, digesting, my body's going to be more loose. It's going to be able to actually relax like that. So if a muscle's super tight, it's going to be holding that, and that's where it comes to. Yeah, we can treat the muscles, but is it going to fix the underlying problem? The muscle is usually a symptom of that, and sometimes the muscle can come first. Lifting weights, stuff like that, the muscle can come first. But a lot of times the actual root cause of the problem is going to be neurological stimulation.
Yeah.
So
I believe that.
Anyway, what was the question?
You were the one asking me the question.
something about fashion. Very similar to the kind of hero worship that comes with certain things. Like, oh, this guy's so good. Everything he says is golden. And you see that with so many other things too. It becomes almost like this cult-like behavior. Like with Liver King. Throw him out there. It became this cult. And yeah, there's a lot of benefits from it. I'm not going to knock things that he was teaching, like the 9 ancestral tenets. Like, I can't tell you off the top of my head, but there's a lot of them I agree with. Do I think he took it to a really hard extreme as a marketing ploy? Absolutely. And do I think there's benefits to eating liver? Absolutely. Do I eat raw liver? I don't eat raw liver, but I'll cook liver, and it's a phenomenal item right there that your body can actually use all of it. And there's so many different aspects. One of the difficult things for me is in our profession, you have the apologists, the people who are excited to do what we do, and then you have the people who, I'm trying to find out how to put this, PC. They went to chiropractic school because they couldn't get into school, and now they hate chiropractors because of it.
Yeah,
because like it's a little bit it's easier to get into chiropractic school. That's when they get you. It's really high. What's it called?
Like a dropout rate.
Yeah, dropout rate. Really high dropout rate because people get in there and just like, oh well, there's no way it's going to be as hard. And then first semester, it's like, hey, here's all these credits. You got to take all these 21 credits in the first semester. And you're just like, oh, wow, this is one. The second semester goes up to like 20, 24, 26, somewhere in there.
Yeah.
And then you hit 28, 28, and people are just dropping like flies because they can't handle it. And
which I think you spend all that money and that time, you get into the profession, and if you really don't find your philosophy and your passion in that field, that profession, you graduate and it's all you have now. You've got these student loans, you have all this, expectation to now be a chiropractor. And if that's not what you want to do, you end up being like a lot of people I think out there where they go through the motions. It's the, mom and pop rack and crack and type shop. And and they just look so dead inside. Yeah.
You hate because you didn't get into it because of your passion.
Yeah, and you're not practicing what you preach. You're not being adjusted. You're not living, like health.
And I feel like a lot of chiropractors, people that I've known, I mean, you have to be able to stand up to people who think that you're quack. In essence, you have to be able to stand up to people who don't agree with what you do, who don't see the efficacy of what you do, and who know nothing about what you do.
Yeah,
who have heard something from some other authority in whatever capacity they are, who said, oh, well, they do nothing. There's no benefit to it. And then you have this whole different pot of people who are like, I live by this. Like, I feel so much better. My body's well adjusted. I'm able to adapt for all those situations. And
those are my people. Like, that's the tribe. They're the underdogs.
Yes.
And they're okay being that because we have to scrap for every bit.
The underdogs right now are winning hard.
Well, yeah.
So
and we're okay being the outsiders that are changing the system from where it used to be.
Yeah.
And we have to bring the results before anybody's going to listen to us. We have to show, that we know what we're talking about and really win people over, because they're not just going to walk into an office and think that we know what we're talking about.
Yeah.
Every little victory has to be won with research and
one of the best things about our job, and especially is like that I love about being someone who loves to learn, someone who's still learning, who's still doing all this stuff, especially you as well. I love watching or talking to people who have no idea how much I know as a chiropractor, who just think I just pop and crack people, and being able to talk about these term medical topics, talk about nutrition, or you being able to talk about neurology as well, and me being able to talk about neurology, and just watching them be like, how do you know any of this stuff? Or when it comes to x-rays, being able to read x-rays, I mean, it's interesting because we take more radiology training than pretty much any general doctor does, besides a radiologist. And so being able to read x-rays and having that knowledge, stuff like that. And I remember talking to my parents and be like, oh yeah, this is what my pay and insurance. Go look at your copay that you have to pay. Like if you have a surgical intervention, something like that, if you stay in the hospital for a day, you're going to be paying a lot of money, even if you have really good insurance. If you go to a chiropractor once or twice a month for a year, you're looking at what, maybe 500, 600 bucks. And
you factor in the opportunity cost of work that you miss and just your quality of life. I mean, $500 or $600 to not hurt every day.
And then on top of that, I mean, you add, let's say you get some nutrition advice. Let's say you find somebody who knows good stuff about nutrition and exercise. I mean, let's say that costs you about $3,000 or whatever over a year period. You're looking at like $3,600, $3,500 for a year. I mean, if that can keep you out of hospital, I mean, feeling good, functioning well, is $3,600 a year worth performing your best and feeling amazing all the time?
It's funny because we live in a society where we're conditioned to think that money should be going to an insurance company to cover you in the event of a catastrophic injury or illness.
Yeah.
And we can take that money, and now thankfully with like the FSA and HSA, prominence, people are now taking that money and putting it to something now that it's an insurance plan if you think of it that way, because I'm proactively insuring against my body completely breaking down
Yeah.
because I'm getting my system checked regularly, and that would be the best $3,600 you spend. It's not going to insurance just hoping for something bad not to happen. It's actually something I'm doing actionably right now to with that.
And it's not like you get to the end of the year and you're like, oh my gosh, my insurance deductible's covered. I need to do all of my procedures now.
Yeah, and then October through December is just surgery season.
Oh yeah, you just feel terrible, and so you hate winter because you're just constantly inside trying to recover from something. Or you could just take care of your body the entire year, and then I mean, you get to the end, you're like, I can enjoy this. And
trick or treating, and
we talk about turkey. I mean, if we talk a little bit about like functionality, you talk about being able to function well in life. Would you have 3 years where your body, you're overweight, you're struggling with all these different things, and life just is it's a struggle. Or you have 1 year where your body's just you're able to have no pain. You're functional. You can do things that you want to do. I would much rather have a year where I can do things how I want to do them and feel great, as opposed to 3 years where I was just there. But I felt like garbage because I didn't treat my body well, because I didn't do the necessary things like exercise, eat well, get adjusted regularly, and be able to actually express myself in the way.
I think from a physical standpoint, any human who owns and operates a nervous system, which is all the ones I've met so far, except for maybe our president, is duty bound to have that thing work as best as they can, to take the best care of it that they possibly can. I know a lot of people who are they're focused on their diet, on what they eat, what they drink or not eat, and they're neglecting the big picture because they're so focused on these tiny little details. And sure, you might not have an addiction to meth, but you can't pass a cookie shop or a donuts shop, without going and just loading up on sugar.
Yeah.
And I think that's kind of sad, because there's so many. I'm not advocating you trade out those addictions for each other, but
Yeah.
I would say we need to be careful that we don't miss the forest through the trees, and that you're taking care of health generally before you start focusing on those minutia and worrying about carnivore versus keto and all that stuff, when you would be better just cutting out processed foods for starters.
Oh, it's such a great starting point. I want to talk about like, and I'm not a proponent of any one diet works for everybody. But if you cut out processed foods, and this goes for everybody, you will feel better. Cut out processed foods from your diet. Eat whole foods. You will feel so much better. Cut out crappy dairy. Get some raw milk, something like that. Get some quality food, and you'll notice a huge difference. Just stop eating all those little treats. Stop eating all those. And I mean, heard it before, and I've said it. And I'm personally, I have a problem sometimes. I like protein bars, certain protein bars, but I feel like garbage after eating them. But in essence, a protein bar is just a candy with protein in it. That's what it is.
Well, it's not as
It's just protein bar candy. I mean, it's a candy bar with protein.
Yeah.
So, okay, next question for you. We've talked a lot about nervous system. So tell me a little bit about your education in school. Like in chiropractic school, you tell me a little bit about before, but I want to know specifically about what things that you were passionate about studying when you were in school and what your education.
Yeah, so my undergraduate, I studied archaeology, forensic archaeology, foreign languages, international business. My emphasis
He
was
speaks 10 languages.
um, that number keeps going up, I swear.
It's always been 10. It literally is going up. He studies like, oh, guess what? I learned all these phrases today in Old Norse. Yeah, okay. Hey, Kaleb, what does this say? I don't know, but it's this language.
You're claiming my time here. Yeah, so my emphasis, my passion was in Middle Eastern culture and Middle Eastern studies. But when I got to chiropractic school, I was able to test in as a business background, because I did have some pre-medical prerequisites that I was thinking of going to med school. And life went a different direction. So when I tested into chiropractic school, we start with anatomy, basically 101, biochemistry, cells and tissues, which is histology, learning how these tissues interact,
your kind of
all
basic
the basic stuff. Yep. And then we move into kind of gross anatomy, where we're actually opening cadavers. And
the coolest classes of all time.
That was great. Yeah, you guys are awesome. But I didn't expect chiropractors to do that. You go to a massage school or something, they have a cadaver there that you can observe and things like that. But And in our day, at least you could go into the school, they had anatomical gifting, and we cut on bodies, and there's nothing like being able to pull out these pieces and look at them. It's like if you're a computer major, a computer science major, you're going to take apart a hard drive. You're going to see what makes it hum.
It does.
And so we would dissect gross anatomy for the first bit, and then we'd take the brain and the spinal cords and we'd study those in more detail in neuroanatomy classes. And so you get very really good working knowledge of the anatomy of the nervous system and what makes it tick. Now, a lot of our profession is there to pass boards, and we'll probably never revisit some of those topics again if they're passionate about what they're doing to the point that they read research papers. At the end of the day, more power to them because they're going to keep
putting out there. If you are in a capacity as a healthcare practitioner, I'm going to use the word practitioner. Practice what you preach. Keep learning.
Yeah.
Don't stop. Like just because you got through school doesn't mean that you get to stop learning. Like continue to learn, continue to get the newest information we can. We need as much research as we can to prove what we're doing and to make sure that when you have someone come in that has a condition that you haven't seen before, that you are ready, that you're ready to refer them to the appropriate doctor. Like if someone comes in there having a heart attack, like be ready, be able to recognize the signs. If someone has a condition where you can't do anything, have a network of people set up of medical doctors, of different other practitioners that you can refer to that you trust.
And be curious about it. I think our medical programs now are just grinding all the curiosity, the mystery out of medicine that we've always had healthy respect for as a people. And we have doctors now that just think that they've seen it all, they know it all, and either them and or Google can fix everything.
It's a one size fits all.
It is. And so any doctor who is curious enough to really get to know a person on a personal level and figure out what's going on with their system is just by default they're going to do.
And sometimes it's a good thing to understand things outside your scope. Like as I'm going to talk to medical doctors, who I have a great respect for medical doctors because I mean lots of schooling, lots of stuff that goes into that, and some really good friends who are in medical school who have graduated from medical school, and all the respect in the world. But it's really hard sometimes when you get so specialized in a specific thing where it's like this person's a doctor, but what do they know about any of these conditions? Like, oh well, I'm not a gastroenterologist. I can't answer any of those questions because I don't know anything about that. I think it's important that we understand different things about the body as a whole. If you're a doctor, you should be able to understand kind of your basic stuff. Keep being interested about things outside of what you specifically specialize in.
Yeah. We were talking just the other day about a Reddit post by an anesthesiologist who had a very strong opinion about upper cervical adjusting in chiropractic.
Like adjusting period.
Of adjusting.
Yeah.
I'm like, okay, I respect that. I don't have a strong opinion on what you do because I don't have the training to really weigh in, especially on a public forum like Reddit. I'm not going to put my ignorance out there for the world to see, but he had no problem doing that, and more power to him.
I think what I said was someone who said, popping my own neck, is it bad to pop my own neck? And where should I go to a cop? And the guy's response was, he said, you shouldn't ever pop your neck, and don't go to a chiropractor. They don't want you to pop your neck because they want to pop it for you. Yeah. And it's just, he obviously didn't understand anything about the topic, and it's okay. Like they don't have any education on that. But I think there's an ignorance to it.
Why would you not ask a chiropractor why or why not to pop your neck?
Yeah.
If that's what we do all day, is the world sees it.
Should I take an ibuprofen for this condition? Should I take a Tylenol for this condition? And I mean, yeah, I have different opinions on stuff like that. But go to someone who has
that's outside my scope.
Yeah, go to someone who has the scope, who has the actual training
and knowledge about they have the latest research on it too. Yeah. They keep up on it, and they can be like, oh well, just recently this study came out that says this, and you should know this before you do that.
Yeah.
And I think we're losing a lot of that, and just because people don't know who to go to with these questions. Yeah. And so somebody has some letters after their name, and they look like they know what they're talking about. That may or may not be the case more and more. So
lots of good points made. So here's a big question for you. How often should a person get adjusted?
Yes. That is a good question. I think that very much depends on the person. And I think people who are just coming into the chiropractic world, first of all, I tell them to shop around and find a chiropractor, find a technique, find a philosophy that really matches what you feel like is right for you. And just Googling somebody and looking for 5-star reviews
You
is,
can pay for those reviews.
yeah,
Like you have to realize when you go on Google, you can pay to have anything less than a 5-star review removed from your page.
yeah, very much a pay to play type of a system.
Absolutely.
And there's reputation management companies that just make a ton of money keeping really bad doctors look like they're really busy.
Yeah.
And so be careful for that. Talk to somebody who has been to that office.
Referrals are the greatest thing.
Yep.
Get people that you trust that have been somewhere, and I mean, go try them out.
Yeah, try it out, and if you don't have a great experience, try again or try a different way or talk to that doctor and just have that open communication. But up front, it's going to take more energy and more effort.
A good doctor is going to be able to have several people to refer you to.
Yeah.
Like several other doctors, like, hey, if I'm not working for you, if my technique's not working for you, if my philosophy's not really along with what you're doing, here's this other guy I can send you to. Here's this other doc that I trust. And I mean, the good thing is that in this office we have both of us, so
we have patients that don't vibe with our philosophy.
Yeah,
they're looking for spinal decompression and back pain treatment there. And so maybe this isn't the office for them, and that's okay. It doesn't mean that chiropractic won't work for them. It just means that our emphasis on function and wellness might not be where they're at just yet.
We're less of a super disability, less of a deterioration, and
yep, we don't do personal injury.
I'm not going to sit here and talk to you about how your spine is degeneration, the degeneration model, which has been pushed so hard with chiropractic for so long. Is why people associate so much with back pain.
Right.
It's like, oh, here's this degeneration model where your foramen are starting to have this osteoarthritis in there, arthrosis, all these different things, and it's impinging on these different aspects and disc degeneration.
Which, let me just go on a little soapbox about that for a second. And we worked with a doctor who everybody that walked in, you have scoliosis and one leg is shorter than the other. And for the rest of their life, that's what they believe about themselves.
Yeah.
And so any chiropractor they go to after that, well, doc, I have scoliosis and one leg is shorter than the other. And I'm like, well, lay down, let's check it out. First of all, scoliosis is 10 degrees or more in spinal curvature on Kaleb. It's a very specific way of measuring that. You don't just look at somebody who's a little off kilter and say that they have scoliosis.
There's so many aspects that play into someone being off kilter.
Yes, and that diagnosis sticks with them forever because that's all they care about. That's all they really know about. And a really good chiropractor will educate somebody on the subluxation. And in language, we just say, oh, you have some interference to your nervous system that's preventing you from functioning at your best.
And then my philosophical addition to that is this lack of neurological involvement and kind of uniformity is going to create these dysfunctional patterns, which that's where the muscle retraining comes in. Your body's starting to train your muscles to act in a different way to avoid pain.
Yeah.
And so it starts with that neurological dysfunction, interference, and it becomes a dysfunctional pattern biomechanically.
Absolutely. And how you move and how you live.
And that's just going to continue to perpetuate it. So we have to address first the neurological system and then address biomechanical differences. And that's where it comes. That's what we call ourselves form fitness and chiropractic. It's because we believe that they go together so well.
Once you're out of pain, once you're reconnected with your brain and body and that interference is reduced, then you're going to want to move. You're going to want to strengthen and use those pathways to create new movement patterns and healthy eating habits and better sleep patterns and all of that stuff that leads to health. Because just removing that interference to have somebody go back to Netflix and Cheetos is just the biggest waste of all of our time and energy. So
sorry, I threw you off.
That's okay. I was just saying, I wish more doctors were not so hesitant to preach leg length discrepancies and scoliosis, because that's the low-hanging fruit that they can convince people that they can make a difference there. The research is still very much out there about what causes these things and how efficient they are.
So the reason they call it idiopathic scoliosis.
Yes, that means we don't know what causes it, and that's okay. But scoliosis in general, I very, very few people come into the office that tell me they have scoliosis that actually have scoliosis that I can identify on x-rays with that standard. And so between the time they left their last chiropractor and showed up at our doorstep, they must have been miraculously cured from that. Or maybe the last chiro was just desperate to give them something to that he said that he was fixing.
This is something I need to treat.
Yes, or I can't tell you how many times they come in with, oh, my doctor says I have bone on bone, waving their knee around. What's your response to that?
Oh my gosh, it's just
if you can bend it, you've got cartilage in there, right?
yeah. There's some sort of something in there. Like if you're bone on bone, like it's gonna be pretty freaking painful.
Yeah.
Like you gotta realize there's like David Goggins. I'm gonna reference David Goggins. Like bone on bone. You look at his X-rays. Like that man ground everything into powder. Like his body was just destroyed. Like if you're bone on bone, there's so many times where people come in and they say, well, my doctor says I'm bone on bone here. It's like there is still something in there.
The fact that you can move it.
Yeah, the fact that you can move
and
it.
you haven't run 120 miles on broken
Yes.
legs like David.
Pretty sure you're okay.
Yeah, but I want that to give people hope. I'm not I'm not diminishing their pain description at all because I'm sure it feels like it's bone on bone. There's bone spurs, there's joint mice, there's cartilage degeneration that's just, they live with chronic inflammation and pain every day. And I don't want to minimize that at all. It should give you hope. Like, hey, we've got some cartilage in there.
There are so many different things, and I think hope is the key word. Yeah. There's a lot of doctors too. I mean, medical doctors, chiropractic, like doctors of chiropractic, that you go into and they're going to preach the gloom and doom. Like if you don't get treated right now, your body's just going to, like you're going to be crippled by the time you're 50. You're going to look like one of those little people who's punched back over. And absolutely not, guys. Come on, we can do better.
If that scare tactic is the only thing you can get somebody to say yes, then you're probably not delivering very good results for people that aren't in that situation.
Do we need to put out there and let people know, like, hey, there are a lot more serious problems that can come from not getting treatment or not treating your body the right way? Absolutely, people need to know those things. But if you get every single person, like, if you don't do this at this amount, like your body's gone.
And that's the model of the other side of this whole spectrum that tries to create a problem that they then medicate you the answer to.
I mean,
and people are tired of that.
I'll refer to another one of my favorite podcasts that I've listened to. It was Joe Rogan and Russell Brand. And Russell Brand, they're talking about like capitalism and stuff like that. I don't want to get into politics in this, but he was talking about how in this world we should be trying to fix a problem, find a problem, fix it. You should be working yourself out of a job. Yeah. As chiropractors, like I don't want to see you all the time. Yeah, absolutely. I want to see your face. I want to be friends and stuff like that. I want to be able to give you the.
I'd rather see you in the gym, though.
Absolutely, I want to give you the tools that are going to help you, and whether you want to follow a workout plan, whether you follow a meal plan, that's something I can assist you with. Whether getting you well adjusted and getting you adjusted regularly, but not seeing you all the time, is something where I want to give you the tools. Give a man a fish, feed him for a day. Teach a man to fish, feed him for a lifetime. Yeah. And it's the same thing with like if we find a problem, and so much of this world has now become find a problem, create a solution, but that solution is actually another problem because now you've created dependency on that. I don't want to create dependency.
Yeah.
What the reason why people when they go and see a chiropractor and they're like, once you see a chiropractor, you have to keep going. It's because your body finally realizes what it feels like to be well, to feel good. Like you're gonna feel what it feels like to move the way you're supposed to be in that kind of relaxed state of being because your body is actually able to adapt.
And would you rather live a life where you are paying and waiting outside a chiropractic office or a gym or a basketball court, or one where you're standing in the Walgreens line to pick up your prescription for that week, or you're going to the PT because you hurt something for the umpteenth time, or you're waiting to see a surgeon about a problem that could have been corrected 20 years ago? Yeah. You pick the type of intervention that you take with your health, and if you pick it well, you live a great life.
Yeah, I was in the hospital and in college because I was original plan was being an orthopedic surgeon. I was working in the hospital. I remember like sitting there. I think I'd been there for 2-3 months, and just after another person came and they're just like, hey, I just need pain meds or super overweight, something like that, to where it was very much a lifestyle condition that caused that problem in their life. And they come in there, it's like, I need something quick, like give me something. It's like there's so many other things you could do. And they never seemed happy walking out of the hospital. Like it was just a sad place to be. I hated it. And I get that there's a lot of no one ever wants to go to the hospital. But then I went and I talked to one of the professors, and he told me, he said, you should go shadow other people. And I found this sports chiro in my hometown. And I would shout him, and I remember I got in there and I was just gonna shout him for like 2 hours or something. I spent 6, and he hired me right after, and I freaking loved it. The people that came in were so excited. They got in there because they knew they were going to feel better. They knew they were going to give him, he was going to give them something that they could take and apply. And and that's what I loved is people came in, they were so happy about it. And I didn't know much about chiropractic. I had only adjusted like twice or something before that. And I remember just thinking, oh my gosh, like these people love this. They're so excited. They understand that this is going to help them. This is going to make them feel better. And you see that all the time. I think that's what you need to judge things by. Is what are the people that really do this? What are they like?
Yeah,
Happy?
yeah,
Are they getting the results that they
absolutely. Well said.
want? Well, that kind of concludes our time. Do you have anything else you want to add?
No, that was great. We went on a lot of different tangents. Hopefully, you guys gleaned something from it. I always enjoy these types of talks and
Yeah,
really kind of getting outside my head and vocalizing what I believe and why I believe it.
absolutely.
Both of you. So,
We're gonna have a couple more our other episodes that we're gonna do after this. We're gonna have it try and be a little bit more structured in certain things, kind of address certain topics because these have been very much philosophical talks, just kind of get to know you things, and we want to really get into things that are going to interest our audience, and I mean they interest us overall. As much as I want to talk to you guys, like well, I just want to talk between us. There's so many times when we talk, we'll be on like a car ride or something like that, um, or I'll just like call them up or something and just be like, hey, dude, we need to talk about this, and we'll have like a 20-minute conversation about some topic that's very poignant, that's very applicable to right now because there are so many different opinions out there,
yeah,
and everyone wants to say that their opinion's right. And I'm very opinionated. I think a lot of my opinions are right, but but when it comes down to it, there's a lot of things I don't know, and especially when it comes to the healthcare profession, it is constantly evolving, constantly changing, and there's so many different uh, things that, especially in nutrition, I mean, more research gives us more insight into different things.
yeah.
So,
Cool. We look forward to seeing you guys on the next episode. Thanks for joining us on this edition of Hey Doc. And again, send your questions to our Instagram message here below, and we would love to feature some of these topics in future episodes.
peace out.
Have a good one.